with Dr. Yanni Van Loghem, how to manage the fatty tissues during the aging process. This is a sequel to a previous show on the aging process. Aging, Wikipedia definition, is the accumulation of changes in a person over time. Aging in human refers to a multidimensional process of physical, psychological, and social changes. Dr. Van Loghem is a cosmetic surgeon who treats people with skin and aging problems. Did you hear that? In this broadcast, he will share his insight and knowledge about skin and aging problems. So that means if you have problem in your skin or about your age, and you just want to reduce your age and look as if you are, meanwhile you are 50, but you want to look like a girl of 23. Hey, Dr. Van Loghem is capable of changing some things in your face and in your body, and then you will just look young. That's why you need to join this broadcast and give a call, live call on 020-737-1619 and interact with Dr. Yanni. He is a member of the Dutch Society of Cosmetic Medicine and the American Academy of Aesthetic Medicine, specializes in Botox, fillers, and chemical peels. Now, welcome to Radio Voice of Naija, Dr. Yanni.
Thank you so much, Helen. I appreciate it very much that you got me back here again.
Yeah, it's always too difficult to get you because you are too busy.
Yeah, I'm very busy.
Thank you for being here with us.
So you got me in the early hours, huh?
Yeah. Thank you for that wonderful sacrifice. We appreciate it.
Oh, it's lovely weather. I can imagine that. It's the temperatures now are starting to look like Nigeria.
Yeah, absolutely.
Even it's hotter. Yesterday was about 30 something.
Yes.
And the highest we've ever experienced in Nigeria is 27, 23, 24. Yeah.
It's always constant.
Yeah. Well, we thank God. So, now, this is a quotation that we just picked up, and we want you to analyze this quotation, please. Here is a quote from an online journal on fat tissue and aging. It says fat tissue, frequently the largest organ in humans, is at the nexus of mechanisms involved in longevity and age-related metabolic diffusion. Fat distribution and function change dramatically throughout life. Obesity is associated with accelerated onset of diseases common in old age, while fat ablation and certain mutations affecting fat increases lifespan. Any comment, please?
Oh, that's a very interesting subject. It is very interesting. Well, fat is of course one of the most important tissues that we have in our body.
Yes.
It functions in different ways, especially if you look at the superficial fat below our skin. We need it for insulation.
Oh.
It's very important for insulation, so for temperature regulation. But also it functions as like a mechanical cushion to protect the body and the organs. And if you look at the inside of the abdomen, we can see that our organs are also covered with fatty tissue. And also this has a function because it is like a connective tissue, like a loose connective tissue that allows the organs to move, but within certain boundaries.
Wow.
So if we look at the aging process of the fat, and specifically if we look at the aging process of the facial fat.
Yeah, facial.
So the fat of the face, we can see that, with all humans, the fat will change from a young age to where you reach an older age. And the changes in the fat tissue will make you look older.
Oh.
And the reason it will make you look older is because with all humans, the fatty changes will occur in a predictable way. So with everyone, it happens kind of in the same way.
Really?
Yes.
That means both or the same way with man or with woman?
Exactly.
The same way?
Well, in almost the same. Of course, not everyone is exactly the same. But we can predict the changes of fatty tissue. For example,
Yes.
if we look at the upper third and the middle of the face, we can
Yes.
see that there is a reduction of fat. And if you look at the lower third of the face, we can see that there is an accumulation of fat. So that's exactly what we do in the clinic, in my clinic, Doctors Inc. in Amsterdam, is we focus on reconstructing the youthful anatomy to make people look young in a natural way. So we increase the volume in the upper and middle face where we've lost the fat, and we reduce the volume in the lower face where
Yes.
there's a fat excess. So to increase the volume in the middle and in the upper face.
The upper face. So the upper face, how does it? What happens in the upper face? Because I've heard you talk about the middle face, the reduction,
Yeah.
and then the lower face,
Yeah.
the increase.
Yes.
So that means from the mouth side to the
the neck,
jaw.
yeah, exactly.
So it's big.
Yes.
Could it be because we are chewing all the time?
Which is like the good food, huh?
So what happens in the upper face?
Okay, that's a very interesting question, Helen, because there's not so much fat, is there, in the upper face?
Yeah.
But actually, there is fat in the upper face, and it is just below the skin, above the eyebrows. You will get a reduction in fatty tissue, and also in bone. There's bone resorption above the eyebrows, because if you look at a young person, you can see a perfectly round forehead.
Yes.
But if you look at an older person, sometimes you get kind of a concavity above the eyebrow. So the forehead becomes a little bit indented, and the older people get, the more that becomes apparent.
Yeah.
You're looking at me with a strange look. Because you look, it's like, what is he talking about?
Exactly.
But have a look at older people.
It's true.
And you can see that there's going to be a little.
A bulging, like it's bulging.
No, it's not bulging out, but bulging inward. There's because the bone and the fat are becoming thinner, just above the eyebrows.
Wow! If you are out there, please just take the mirror and you need to see this description. My God! Well, you have not missed anything yet, because I think this broadcast is going to go on live as well in Majesty Christian Television Network. So you can see the description that Dr. Yanni is giving me here. But take your mirror and look at your face. Your upper side, is it getting thinner and thinner? And then it's like your bones over there are sinking. And then the middle part of you, is it becoming reduced and then the lower part of you, is it becoming bulky, like as if something is dropping? If that be your case, then you need really Dr. Yaga.
Well, actually, Helen, as the medical technology progresses, we get more and more refined devices.
Okay.
And where in the old days we used liposuction to reduce the fat in the lower part of the face.
Okay.
Liposuction is still a very good method to do that.
Okay.
But nowadays we have this really amazing little device. It's a very small device. It's like the size of a DVD player.
Yeah.
With the price of a small car.
Wow.
It's a very expensive thing, but what it does, it will give, there's an optic fiber, and through that optic fiber there's a laser.
Yes.
So we bring the laser underneath the skin and into the fat.
Yes.
And the laser will melt the fat away, and it will also give some heat. So when we keep the laser near the skin, like putting a steak in a frying pan.
Yes.
The skin will give some contraction.
Yes, exactly.
And sometimes it even sounds like there's frying something because you hear the
oil boil.
the oil, exactly.
And where does it go? Hi, Yanni, you're making me crazy this morning. So where does it go?
Well, you know, because we have to make a very small opening with a needle in the skin, we can kind of massage the fat out through that hole because it becomes completely liquefied. And so while the patient is laying there, I'm just massaging the fat of the under chin out of this very small hole.
Yes.
And it is such a nice job to do because it gives me a lot of
satisfaction.
Exactly.
Seeing the prophetess coming out and then giving somebody a new outlook.
Exactly.
Is that so? So how long does that take, honey? How long does it take?
The treatment.
Yeah.
It takes, you know, it's a very fast treatment, about 1 hour. 1 hour, and then it's under local anesthesia.
Really?
Yes, and you know, and it really improves the look of a person because it gives a definition back to the jawline.
Yes.
And that really rejuvenates.
Wow. My God. Science is powerful. An applause for science. Wow. Really? This is awesome. So, what is fat? How does the fatty tissue impact the aging? Of course, I think you've described it now.
So what is very interesting? I mean, from a medical, scientific point of view, I am very much into anatomy. You know, for me as a doctor, the anatomy is the basis of everything.
Yes.
We have to know, as doctors, we have to know exactly everything about the anatomy.
Yes.
So one of the recent insights into the anatomy of the fat is that before, like even like 10 years ago, we thought that the fat underneath the skin was just a continuous sea of fat.
Yes.
But with cadaver dissection studies,
yes,
and I will tell you what that means, but with cadaver dissection studies, we have discovered that the fat is actually not continuous. It is organized in discrete compartments.
Okay.
So underneath the skin there's all these little bags of fat which are not continuous, they do not communicate together, but it's like a jigsaw puzzle that they are
really? They're apart.
Yeah, so just like our bones and like our muscles, our fat has different fat compartments with their own anatomical names and their own anatomical locations. So this is very interesting.
Yes.
And cadaver dissection studies is a way of you know, getting to know the human anatomy. And what they do is there's a dead person who has given the body to science.
Yes.
So what they do is they inject in a certain point of the face, they inject in the fat a certain color, a pigment, like a blue, methylene blue.
Yes.
And they let the pigment wait for a certain amount of hours.
Yes.
And so the pigment diffuses, it spreads.
Yes.
And then after a few hours, they take out the skin of this dead person, of the cadaver, and then they look where has the pigment spread to. So from these studies, they've discovered all these fat compartments in the face.
And then the pigments, the spreading, did it reach to the other compartments, or it just stayed intact in one?
It just
stayed. Like bags?
Yes, it just stayed. So yes, and from this research, they've shown that everyone has the same anatomy. Like we all have 5 fingers.
Yes.
We all have the same amount of fat compartments in our face.
So that means the fat compartments should be 5 as well, or 3 or 4. So every human being have that.
Exactly.
Even as a child.
Even as a child, exactly.
God is awesome.
He is, isn't he?
Wow! Somebody out there listening to this broadcast and you have something to ask to Dr. Yanni, please feel free to give us a call right now on 020-737-1619. This is coming to you live from Radio Voice of Naija, discussing the aging process, dealing with the fat tissues with a specialist, Dr. Yanni Loghem. Give us a call. Give us a call. We want to hear your view on this. So, but as you were describing all of this, I wanted to know how does this fatty tissues but it's just fat, the accumulation of excessive calories? Is it just an accumulation of excessive calories, or is there something else that is breeding fat inside us?
Yeah, there's actually, you know, these different fat compartments. They not only have their own anatomical name and their own anatomical position, they also have their own personality.
Okay.
Let's go for the call.
Yeah. Hello, caller? Yeah, good morning.
Guests.
Oh, let me hear you. You know, we cannot really hear you very.
Yeah, I think I understood the question. He was asking about the laser lipolysis machine.
Yeah.
He's asking if there's also a possibility to treat the belly.
The belly. Oh yes,
Is
exactly.
Is that correct?
Is that a question?
Yes. Okay.
Oh, okay. Thank you so much, Uncle. But then listen and then hear.
Oh. Okay,
Yeah,
so
listen.
well, I think he's still listening to the radio, so
Yeah,
I'll
he's
try
listening,
to
yeah.
answer your question. The belly fat is also a great target for a fat reduction treatment. However, the belly fat, if it's too much, then first I will send my patients away, because sometimes the fat is too much.
Yes.
And then first they need to lose some weight and diet.
Okay.
And then when there's an amount of fat left that can be treated satisfactorily,
Yeah.
then I will treat it, because if there is too much, there will be not enough difference.
Okay.
I will be working for hours and hours and hours, and then there's not enough fat reduction.
Okay.
So also there's, of course, the reason for that is that I can only infiltrate a certain amount of lidocaine, which is the anesthetic.
Okay.
And if I need to increase the amount of fat that I want to reduce, then
Yes.
I also have to increase the amount of anesthetic, and there is a
That's what
certain
we-
maximum
Yes.
that I can inject into the fat.
But
So-
can that not be done gradually, like maybe every 2 months or every 3 months, and then you are able to do about 4 surgeries on the person?
Of course, but that's going to be very expensive for the
Oh,
person.
All right.
Actually, we have a special in our clinic, Doctors Inc. right now.
Yeah.
It is for the under chin. It's not meant for the belly, but it's meant for the cervical area and
Yes.
for the jowls, you know,
Yes.
at the lower cheeks and the under chin. And instead of paying 1,800, people can now do the treatment in the summertime for
Yeah.
900. 900. What was it? 90, I think. 990. So
A reduction of 800? Yeah.
exactly.
Or even more than that.
It's like 45% discount.
Yeah.
Yes.
Wow.
We have a special, and it's in the week of the 23rd. So exactly in 1 week time, we have 1 week of this special price.
Wow, say it again. So, somebody out there listening, you can have these fatty things being removed on your face.
Yes.
The facial treatment.
Yes.
Okay, just at a cost of 990 euros
Yes.
as against 1,800. Wow. So make use of this opportunity. Is it only for this summer?
It is actually only for next week.
Next week?
Yes, yes.
Next week?
It is our summer special, yes.
You better can rush. Whoever is listening to me right now and you want to get yourself trimmed down or reduce to those fatty areas of your face, you better can rush. Thank you, Dr. Yani. Thank you so much for this special offer. I pray that you can even go to Africa and also do some of this, your treatment.
Well, in Africa, probably there's a lot of people who want to get some fat reduction.
Yeah.
I guess so. And you know what another very, very interesting area for treating a person with this laser fat reducing machine is the arms. You know, sometimes you get in the where in the underneath you get these extra wings that flap in the wind.
Flapping women, we have it everywhere. Look at how my own is flapping.
Yeah, okay.
Well, I wants to know my flapping.
Yeah, but you're very happy with them. But some people aren't so happy with them. So for those people, I can help.
I think I'm going to come. So this treatment, how much is it? How much is this treatment? You better tell me, because when I fly to Nigeria, I will just use my own and tell them you can get this reduced. How much is that?
That treatment is 2,500.
Oh my God! So tell me, when you reduce this fat on the face, does it not? The people, do they feel okay?
Oh yeah.
Because
I
mean, there could be some tightness somehow.
You know
Can they laugh the way I'm laughing, or you restrict them not to laugh and not to?
No.
Please tell us the truth about some of these things.
You can do everything. Okay, so so during the treatment, I give some infiltration with local anesthesia.
Yeah.
And so this will make the treatment completely painless.
Yes.
When you're laying and at the treatment, sometimes you can hear like the sissing sound of the butter melting in the pan.
Yeah.
And you can hear like the popping sound sometimes of
Really?
the fat getting boiled.
Yeah, exactly.
And then after the treatment, I just put a small bandage for some pressure, and you leave it on for 2 days. And if you want to go outside, it's okay to take it off. If you want to go and do some shopping, but just leave it on for 2 days for some extra pressure. And there's going to be there's not going to be any suturing.
Yeah.
No stitching, just a little sticker, because it's a very tiny entrance hole that I've used to put the laser optic fiber inside.
Yes.
And so these little bandages should stay on. It's like little stickers, should stay on for 3 days. And that's it. And then you come to the checkup appointment after 2 weeks or 6 weeks, and then slowly it will improve. Even over the months after the treatment, there is going to be a tightening of the skin.
Yes.
So the fat reduction will also increase. So there will be a more defined jawline in the course of 6 months.
And
then you will have a much better underneath of the chin, under chin, and also the jowls. The lower part of the cheeks will also be dramatically improved.
Yes,
after
exactly.
this treatment. Yes, it's really revolutionary.
Wow! Awesome! But this or therapy or this treatment, does it have any implication? Are there some implications?
Of course, there's a possibility of complications.
Yes.
It is a medical treatment, so there are possibilities of complication.
Yeah,
Now,
exactly. That's what I mean. Complications.
Yes, complications.
Yes.
So if you're interested in reduction of fat, it's very important that you don't necessarily go to the cheapest practitioner, but you go to a practitioner of which you know has good credentials. So you can go online and go to review websites. And if you go to a review website like eatsmooier.nl or kliniekervaringen.nl, you can look for the clinics and see the reviews that other patients have written down. And based on those reviews, you can choose your clinic of choice. And to answer your questions about the complication is, of course, the risk of complication becomes less if you have a good and experienced practitioner.
Yes.
So the complications that are possible is an infection. Because we make an opening in the skin. So there is a possibility for example, a skin bacteria to go underneath the skin into the body. So there's a risk of infection. That's why we give our patients prophylaxis of antibiotics.
Okay.
So that means 30 minutes to 1 hour before the treatment, we give some oral antibiotics.
Okay.
And then, of course, there is a chance of bruising. We're going to make a little opening into the skin, and there might be a blood vessel. And if we puncture the blood vessel, then it's possible for some blood to exit the blood vessel and get into the tissue, and that will give a hematoma, a bruise.
But you are an expert, so I don't think you got about puncturing people's blood tissues.
Well, sometimes there's a small bruise.
Hello, Kola. Yes. It's good.
After going through the treatment and how long does it last? Does it make it for life or she come back again?
Yes, that's a very good question. I was about to ask that now. Thank you, sir.
Thank you very much for that question. Actually, we were getting to that question.
So for the other listeners, then the question is, how long can one treatment last?
Okay. Well, this is the good news.
Yes.
If you kill a fat cell, it will remain dead forever.
Wow!
So
really?
So we recently, like a few years back, we as doctors told our patients that after you become 20 years of age, the fat cells lose their capacity of dividing and increasing in numbers. But now we know in these days that this is not completely true.
Yes.
There is still a possibility for the fat cells to divide even at an older age. So we don't remove all the fat cells, that's not possible, and it is, the beauty is also in the fat as long as it's not too much.
Yeah.
So if you reduce the fat in the cervical area, in the neck area and in the face area, then it is possible that over years and years, like maybe a decade, there is going to be an increase again in the amount of fat.
Okay.
So, but it will always be a reduction. So there's going to be a permanent reduction of fat, and maybe in the course of a decade there's going to be a little bit, regrowth of fatty tissue.
A decade?
Of course, a decade, like 10 years. So of course, the fat cells that remain, they will also keep their capacity of gaining volume. So if you start eating fried chicken and French fries every day, you will get fat.
Exactly.
So if you then look at what's happening in the area that has been treated, then the fat cells that remain are just becoming from small ones to big ones. So that will also increase the volume of fat tissue. Do you understand what I'm saying?
Yes.
Yeah.
So what is the good news? Because you said once you kill a fat cell, it's dead for life.
Exactly.
But then other fat cells are still alive.
Exactly.
And they are still working and looking for a way to multiply. So what's then the good news? Because the caller asked how long can the treatment last. So tell us then exactly. Is it maybe every 6 months we come for a touch-up?
No. The good news is that it's permanent. There's going to be a permanent fat reduction.
Wow.
Yeah. And if you start with a treatment like that, If you look at yourself and you look in the mirror and you're so happy with the result, you know that you're doing it because you love yourself.
Okay.
And you want to be the best version of yourself.
Yeah.
So then the step of leading a healthy life
Yes.
becomes easier. Because the more you love yourself, the more you will, you want to do the best for yourself.
So does that mean you don't need to eat all these fatty things like
Exactly.
you made mention of fried chicken?
Exactly. So, you know, and it goes to the whole spectrum. It is not just to look good.
Yeah.
It is to feel good.
Feel good.
And be in balance with yourself. It's about quality of life.
Yeah. Well, somebody out there wanting to make a contact with you, Dr. Yani, or you want to have any part of your face being reduced, or your arm that is having some big rings, please just give us a call right now on 027371619. Every time Dr. Yani comes here, he gives us one thing to think about and to also know that there's a solution. So, from your practice, tell us sincerely, what parts of the body does the fat, what areas do people have much concern?
Which parts of the body? You know, recently.
And is it only for women? No, the ratio.
Yeah.
Is it more of women or more of men?
Well, there is still more women. There's still about 85% women
And men?
15% men.
Really?
Yes.
Men don't care about their look?
Not as much as women.
Yeah, it's true.
I mean, what is attractive in a man? Is it his appearance, or is it something else?
His pocket.
His wallet.
Well, his wallet and all of those things as well.
And what
Really?
is attractive in a woman?
It's the features.
You know,
It's the physique.
I don't like to admit it, but it's true.
Yeah.
You know, it's, I mean,
Yeah.
in my experience, you know, women are judged more
Yes.
in their appearance than
Yeah.
men.
Yeah, it's true.
And
It's true.
also, if you ask a man, you know, what they find attractive in a certain woman,
Yeah.
they will start to talk about the beautiful face,
Yeah.
and the beautiful body,
Yeah,
and
it's
the
true.
breasts, and the buttocks.
Yes.
And if you ask a woman what is interesting in a certain man, she will say, "Oh, he's so interesting and intelligent and funny, and then yes, he's also very handsome."
Yeah.
But it is not as important for a woman.
The physique.
The physique.
Yeah.
I mean, for
It's true.
facial
Yeah.
appearance for a man is
Yeah.
it's not as relevant.
It's true.
But maybe that will change. I don't know. But it's just maybe our culture.
That's the way God made it. Yeah.
And if you ask what is the main concern
Yeah.
with the body of my patients? Well, it's funny. Recently, I have so many patients asking for augmentation of their buttocks.
Augmentation.
Yes.
You will explain that medical terminology because
Yes.
so that the others can know. Hello, caller.
I'm very interested, so I'm calling again.
Yeah, it's good.
Yeah, what is the relationship what the people the doctor does and heart? Let me know there's a difference.
Come again, please.
What is the relationship or what is the difference between plastic surgery and what the doctor is doing?
Oh, the difference between plastic surgery and what you are doing, Dr. Yani?
Ah, that's an interesting question. Thank you very much for your question. The answer, the question, I will just repeat the question. What is the difference between plastic surgery and the thing that I'm doing? Okay. Plastic surgery is like this big thing. I mean, it is more than just cosmetic surgery. Plastic surgery is both cosmetic and reconstructive surgery. So if you get into a car accident and there's something changing your face because of the trauma, the reconstructive surgeon can fix the face to reconstruct the way that it used to be before the accident.
Yes.
That's basically the whole of plastic surgery.
Plastic surgery. Okay.
What I'm doing is aesthetic medicine.
Aesthetic.
So I will do any cosmetic treatment. So to improve the looks of a person, I will do any aesthetic treatment with as low invasiveness as possible, which means if it's possible to do it without a knife, I will do it without the knife.
Oh, that's good.
So for this laser-assisted lipolysis that I'm talking about, this laser fat reduction,
Yes.
it is using not even a knife. I use a needle to make a hole in the skin.
Yes.
And through that little opening that I've made, I will introduce a very thin cannula. And this cannula is the size, the thickness of a needle, but it has a round tip, and through this round tip is coming the optic fiber of the laser. So it's very, very thin. I don't need to cut open the skin. We call it, in the entire medical world, there's a tendency to reducing the invasiveness of treatments.
Yes.
If you have an appendicitis, for example,
Yes.
in the old days, you will get the scar on your belly.
Yeah, exactly.
Right now, you go to the hospital, you will get 3 small openings, and through these openings, they will get it's like they will put a little camera,
Yeah.
and they will get some other instruments inside through
Yeah.
these small openings, so that the invasiveness of the treatment becomes reduced.
Yes.
So we can see the same tendency in the aesthetic world, in the cosmetic medical world, where we will try to enhance someone's looks and to improve someone's appearance with as low trauma and as low invasiveness as possible. And this is one of the amazing new developments in aesthetic surgery, is laser lipolysis.
Yes.
And it's really an amazing new development, because with only a few very tiny openings in the skin, we can treat the whole of the under chin and the cheeks, the jowl area. We can reduce the fat and we can tighten the skin. And the reason that we can tighten the skin is that the laser will give some heat to the skin, and because of this heat, the skin will contract. There will be collagen production, and that will increase the strength of the skin.
Yeah.
And that will tighten the skin and will give you a nice and defined jawline.
I think, Dr. Yani, you see how I'm just looking with keen interest. It could be that the normal people, the ordinary people, do think that or when people receive this sort of treatment you are talking about, we call it plastic surgery. Meanwhile, it is aesthetic medicine.
Yes.
So maybe that could be the mistake we are making. So we go about thinking it's plastic surgery.
Exactly.
Right. So then, do you work in collaboration with plastic surgeons?
Oh yes. At my clinic, Doctors Inc. in Amsterdam, we have one board-certified plastic surgeon working with us, and he is the one that is really treating with the knives. So he is the magician with the knives.
Yeah.
And so if it's necessary,
Yes.
of course, then we will have to use
Cut.
the knife.
Yes.
Then,
Yes.
like for example, like a breast augmentation. You cannot put an implant into
Without cutting.
Without cutting.
It's true.
Yeah, there is actually another way, which is injection of hyaluronic acid, which it will also increase the breast.
You guys are really, really, really good.
Yeah.
So breast augmentation is to push the breast up.
Yes, it is. Breast augmentation means that we take a silicone implant and we put it into the breast.
And then push it
and
up
the
like
lady,
that of a virgin again. Is that what that means?
But she won't become a virgin then.
All right, but the breast will look just that way.
Just that way.
Oh, so to hold it up. Wow.
Now, I have a question.
Right.
What if somebody who's had, let's say, the breast removed because of cancer,
Uh-huh.
what can you do as an aesthetic doctor
Yes.
for this person?
Mhm.
And also from the plastic surgery point of view?
Okay, that's a very interesting question.
Thank you.
So in the answer to this question, it is kind of reconstructive aesthetic medicine. So if you look at what's happening to the breast after ablative surgery, I mean, if a person has had breast cancer, sometimes when it's possible, we do the oncologist, the surgeon,
Yeah.
will take out the tumor and leave as much of the breast tissue as possible. But sometimes that's not possible, and the entire breast
It's
has
taken
to
off.
be
Yes,
taken off.
removed, yes.
So then you will have the situation where you have like a male chest, like a flat chest
Yes.
with no
Yes, no breast.
no breast, no volume
No
left.
bulging.
Exactly.
Okay.
So, and plus you will have scarring. So what we can do for these patients is first, after the wound is healed,
Mhm.
sometimes there's even irradiation therapy, radiotherapy or chemotherapy necessary. But apart from that, when there's a flat breast, then slowly the tissue has to be expanded, and there's different ways to do that. However, I feel that the best way to treat these patients is to use a specific implant which is meant for patients like this, oncology patients, cancer patients. That the implant is a silicone implant, and it has the same size and the same shape
Of the breast.
of the breast.
Yes.
And then after putting the implant, then we can start treating the scar tissue, because the scars can be devastating for a person. To look at your skin and
Yeah.
see all these scars, and those scars are not necessarily made by a surgeon who is thinking beautiful scar. The oncological surgeon doesn't really care about leaving a beautiful scar. He cares about keeping the patient alive.
Yeah.
So after the wounds have healed, then it becomes important, the patient survives, to make the scars beautiful. Now, to use a filler to correct these kind of scars.
Wow. A lot. For the sake of time,
Yes.
tell us, at least give us your candid advice regarding to the aging ones. What do you think you have to leave behind for them?
Okay, first of all, if you're in an advanced age process, then
Yeah.
you're basically blessed.
Yeah, okay.
Because if you don't age, that means you stop living,
Yes, it's true.
right?
Yes.
So we all want to age.
Yeah.
We all want to become old.
Yeah.
And so we have to accept the fact that we're getting old.
Yeah.
And the best thing would be if we would become old in a beautiful way, in an elegant, beautiful way. So it's all about feeling good about yourself. And if there's something that bothers you, why not do something about it?
Exactly.
I believe that everyone should try and be the best version of himself.
Exactly.
And if something is bothering you, if you think, I need to, this under chin is bothering me, or these jowls on my cheeks make me look much older than I feel,
Yeah.
do something about it.
Do something. Yes.
Yeah.
That's a very good advice.
And and because you only live once, make the best of it. And yeah.
Thank you so much, Dr. Yanni. Thank you for being with us this morning. And listeners, I believe that you have heard it from the horse's mouth. So you may make contact with Dr. Yanni at your own time. And in case you have further information or further questions, please just give us a call on 0684-606-550 or go to the website of radiovoiceofnaija.com. Then you can get more information about Dr. Yanni and his clinic, and also their telephone number. For your information, the reclama, the reduction for the facial treatment
Yes, we have
is just
we have
for 1 week.
Yeah, we have a 1 week special, which is next week,
Yes.
starting at the 23rd of July.
Yeah.
That's not, no, that's
No,
tomorrow.
it's this week. actually.
Starting at the 29th of July, sorry.
Okay.
We have 1 week where there is a 45% discount for the laser-assisted lipolysis of the cervical area and the